there's basically I want this to be kind of like not a course, not a lecture or anything like that, but I want to get a little bit of feedback and a little bit of discussion on what you guys want to learn about with scoliosis. You're here most likely to learn something or to understand something better or something like that. So we'll make sure that we answer those questions. I'm going to try this. That's better. You guys okay in the dark? Yeah? All right.
That's why we're here.
Because you're in the dark. That's why you're here today. Awesome. So, yeah, basically, I want to go over understanding your curve. So not understanding someone else's curve, I want you to come away from this with understanding what's going on in your spine. Those of you who have scoliosis. Those that don't, you're here because you know someone who has scoliosis. So understanding their spine as well. So a little bit about me. Some of you know me, some of you don't. So I've been a scoliosis specialist since 2014. 2015 I opened this practice, so we're almost at our 10-year mark of being open, which is exciting. I have a podcast called the Scoliosis Experience Podcast, and we interview surgeons and patients and all kinds of people. I'll have another episode coming out next week. It's on, I think, almost everything. So maybe not everything, but it's out there. And then I'm trained in the Schroth method, the SEAS approach. I'm a member of SOSORT. SOSORT is the International Conservative Scoliosis Treatment Society. And so we have meetings all over the world, which is kind of fun. Next year it's in Croatia, so that should be a good time. And I'm a verified scoliosis nerd. It is my passion. Sometimes my patients are like, you know way too much about this. Do you do anything else? Yes, I do a lot of other things. I'm a native to Utah. I have 4 kids. My wife's over here. This is us on the top of Timp when my youngest was 5 years old. That was a fun hike. But I like to be active, and I like to have fun outside. So let's talk a little bit about what scoliosis is, just so we're all on the same page with what scoliosis is. Scoliosis is a lateral curvature of the spine. So if you look at the spine here, we have a curve that goes to the side. That's the definition of scoliosis. It's a curve that goes laterally, but it's so much more than that the curve is going laterally. There's a lot more to it because we have a rotation, and we'll talk a little bit more about the other things that happen with scoliosis, but the x-ray for the column only tells us a piece of the puzzle. It affects all ages. It's more commonly diagnosed in adolescents. So kids from 10 to 16 are usually diagnosed with scoliosis, 3% of the population. So if you do the math, with 80,000 people in Lehigh, there's quite a few people with scoliosis just here in Lehigh, right? Adults, it's a little more common. The reason adults have it more often is because we have the 3% that were diagnosed when they were adolescents. And then we also have degenerative scoliosis that happens later in life that someone may not have had scoliosis before. So that's why that's more. So common causes of scoliosis. Idiopathic is 80%. What does idiopathic mean? Liam, do you know what idiopathic means? No?
Oh, it says it right there.
Yeah, but what is it?
Dang.
What is idiopathic? What's that?
I don't know that word. I probably should.
It means this, of unknown cause, right? It's a way of saying that we're not quite sure what's causing that scoliosis curve. So we have a lot of causes for scoliosis, but the vast majority is something that we don't really know the cause of. So 20% are the neuromuscular, the congenital, traumatic, degenerative, post-surgical. There's all kinds of causes, but we don't see those as often. So research continues to be ongoing on what is actually causing the scoliosis, because most of the time we don't know. We don't know what's actually causing it. So that's an interesting thing that we still don't know. There's some genetic component, right? There's some genetic stuff, families that have a lot of scoliosis. So in here, who has idiopathic scoliosis? Or the person that you know. So who in here has idiopathic, unknown cause? Yeah? They didn't tell another cause, right? Right, Kent? So if you don't know of another cause, then it's idiopathic, right? So the most common thing that I see here that's not idiopathic is congenital deformities where the vertebrae is shaped differently, and that sparks off a scoliosis, and a Chiari malformation, which is a brain stem issue that creates a scoliosis, but that's not very common. So our sampling here tells us that that's not very common. So it's a three-dimensional problem. So I want to talk about, we look at the Cobb angle that goes laterally like this, and my big problem with just looking at the Cobb angle to determine scoliosis is it doesn't take all the other factors in. It doesn't take the other planes of motion into the equation. So we have the frontal plane, which is the Cobb angle. So frontal plane is if if I take a slice this way, how the curve looks. The transverse plane is rotation. So most of you probably know that scoliosis has what a lot of people call a rib hump, or a prominence on the ribs or something like that. That's how when you're a teenager and your pediatrician has you do this test, they're looking for the rotation. So that's how we detect the rotation. And then we also have the sagittal plane, which is looking at someone from the side. A lot of times in scoliosis we have what's called a flat back, where the spine is very straight in adolescent scoliosis, but sometimes we see an increase in the kyphosis with scoliosis as well. So we have to think about it in all three planes. So